Vision Edge gives you less eye strain and reduced damage caused by blue light. We like to call Vision Edge sunscreen for the eye. It all starts with your highest level of visual performance, only achievable through scientifically proven Vision Edge.
Hi, this is Dr. Kerry Gelb. Today we have a very special guest, Dr. Michael Carter. Michael Carter is an MD. He specializes in functional and anti-aging medicine, regenerative medicine. He's board certified in anesthesiology. He's a functional medical director for Fit Eyes Glaucoma Support Group. He's the chief medical officer for Health Revival Partners and Real Health Clinics. He's the medical director for Tissue Regeneration Technology. He's an expert in PRP, Alzheimer's, peptides, and hormones. He's actually a glaucoma patient, and he's brave enough to come on and share his experience of being a glaucoma patient. So, Dr. Carter, explain to me what it is to have glaucoma and what is glaucoma?
Well, I've had glaucoma for over 30 years, and it's basically a disease of the eye that the pressures in the eye become a bit overwhelming, and it causes destruction of the optic nerve, thereby resulting in vision loss. And pretty much traditionally, the only way to appropriately address that would be various medications, eye drops that could help decrease the production of the aqueous humor, which is the fluid in the eye that's causing the outflow obstruction, or medications that help open up that outlet to help the drainage. It's about 60 million people worldwide actually suffer from glaucoma. And of course, it's one of the leading causes of blindness.
So you're also an expert on Alzheimer's and glaucoma, being a physician. Talk to me about, first of all, about Alzheimer's disease and how glaucoma and Alzheimer's are related.
Well, so I want to go back a little bit and let people know how I got into the functional medicine realm and ultimately with that. So as Dr. Gelb stated, I did anesthesia for 16 years, practiced that, loved that. Had a history even prior to my practicing anesthesia of glaucoma. So I was on some traditional drops and so forth, and they worked for a while. And as in most cases, it becomes refractory. So I ultimately had to have surgery, what's called a trabeculectomy on my eye to lower the pressure, because it was in the 45-50 range, which is a dangerous level, normal being somewhere in the 18 to 20 range. So had the surgery and developed, the pressures became too low. It's called hypotony. So at that point, since I lost significant vision in that eye, and even though I actually had 20/15 vision in my right eye, but still having monocular vision in a high stress environment, where anesthesia is concerned, I decided to retire from that medical specialty, and actually went into the medical spa arena, where became an expert at bioidentical hormone replacement therapy and aesthetic techniques. Actually became a cosmetic surgeon, training both stateside and abroad, learning various liposuction techniques as well as fat transfer techniques. Also during that time, became boarded in stem cell training and so forth. Did a number of those procedures. And but over time, after my liposuction clinics, did that for about 8 years, decided to migrate out of that arena and really focus on how to address my glaucoma from a functional medicine standpoint. Because even though I'd, been on the medications and they were working fairly well, again, I've had it over 30 years and I still have okay vision. So very blessed with that. But again, wanted to, after being a member of the American Academy of Anti-Aging Medicine for 12 plus years now, and learning of root cause scenarios that one needs to address, I embarked on that journey because I just felt that just doing the medications and doing the surgeries, there was something missing. So did deep dive assessment of those things, and actually made the acquaintance of Dr. Thomas Lewis, who wrote the first book, The End of Alzheimer's. And that was probably about 5 years ago. And we really hit it off. And I discovered him on the Alzheimer's Summit. And that was the first Alzheimer's Summit a number of years ago. And his statement that caught my attention was glaucoma was Alzheimer's of the eye. So that really kind of set the stage for me becoming more deeply involved in both arenas. Because of course, from a functional medicine standpoint, I not only was learning things for myself, but also for my patients. Because after I retired from doing the liposuction, I basically became an expert in autoimmune diseases, gut issues, thyroid issues, whole host of things. But the fascination really, of course, kind of took me down the pathway of neurodegenerative disease processes such as Alzheimer's, Parkinson's, dementia, multiple sclerosis, and what have you. And meeting Dr. Lewis and Dr. Trimp, who Dr. Trimp was the ophthalmologist at Harvard, who really shed light on how eye diseases were totally connected with brain diseases. So it was pretty fascinating.
If we back up for a second, if you could just define functional medicine for us.
Sure. So functional medicine really revolves around root cause medicine, and not just simply putting a patient on a medication to address a particular symptom or lab value for that matter. And even though in the functional medicine world, there are lots of supplements that are, suggested and so forth, still you want to find out why the body is expressing disease versus, again, just putting a patient on a medication or a supplement. So again, going down my rabbit hole of how I developed glaucoma, that was one of the main tenets that caught my attention with Dr. Lewis and Dr. Trimp, as one of the major root causes of glaucoma being subacute infections. And even though I had studied functional medicine, and of course had done a number of functional medicine tests on myself, and one of the things that popped up early on when I did my own functional medicine tests was doing adrenal stress tests. And everyone is pretty familiar with chronic fatigue syndrome or adrenal burnout or what have you. When I was practicing, doing the liposuction, we were very, very busy. I had 7 clinics and between Georgia and Florida. So I was actually flying back and forth between Georgia and Florida every week for about 5 years. And my body just got to the point where it said enough is enough. And when I checked my cortisol levels and my DHEA levels, I found out that I was significantly stage 3 adrenal fatigue. So my body just stopped producing adequate levels of cortisol to keep me going. And of course, that affects all other body systems as well. And it makes you more vulnerable to these subacute infections, because cortisol actually is very intimately associated with your body's ability to produce secretory IgA, which is our body's main immunoglobulin in our gut. And as most of you may know, 70 to 80% of our immune system is in our gut. So that was kind of a first rung of just adrenal dysfunction being involved in what I was more vulnerable to. So, so that, of course, I did gut testing as well, and initially found out that I had a couple of parasites and yeast overgrowth and imbalance of the good to bad bacteria ratios. And of course, that has a tremendous amount to do with overall body health, as well as brain health, because now we know the gut-brain axis is critically important. And we must have the good balance of bacteria and just the whole microbiome, their commensal parasites and viruses and so forth, that all make up a healthy microbiome that allows us to function appropriately. So, so those were the two tests that I kind of focused on in my early years of being a functional medicine provider and trying to assess kind of what was going on with me. And those were obviously quite deranged. So it took a while to build my adrenal gland function back up with various natural supplements and so forth. And by retiring from doing the cosmetic surgery and flying back and forth to Florida every week, that allowed my body to at least start its healing process.
As an optometrist, we deal with many diseases that are autoimmune.
Yes.
Many autoimmune diseases affect the eye. And I work with functional medicine doctors locally to try to get our patients better.
Yes.
Can you talk about the microbiome and how it relates to autoimmune disease? And how can we help our patients with autoimmune disease that may have lupus or rheumatoid arthritis or myasthenia or some type of autoimmune problem?
Well, so with the microbiome, again, that is critically important. And because of the toxicities that we are, faced with, the onslaught from our diet, from our water, from our air, and so forth, it is greatly reducing the good bacteria in our gut. Also, people also are exposed to various antibiotics, whether they are prescribed them from their doctors for various syndromes. But more importantly, we are daily getting a significant dose of antibiotics through our food supply and water supply. So this is kind of a continuous thing, and it is slowly decimating our microbiome. And of course, when you take a traditional antibiotic, say a 7-day course of whatever it is, Keflex or what have you, it significantly affects the microbiome and pretty much decimates it for a time until it can be rebuilt again. But having that situation, we need our gut bacteria to, make hormones, to provide, the communication to our brain. A lot of our, thyroid conversion process actually happens in the gut. The vast amount of serotonin is actually made in the gut. So, so that obviously is all, coincident with various disease syndromes when that is in disarray. And some of the other things that are really causing poor gut health, let's take our food supply and let's take wheat, where most people have heard of the problem with gluten. And really, there's a tremendous amount of data that is showing that gluten is inflammatory to the gut and causes leaky gut syndrome, or the traditional medical term is hyperpermeability syndrome. And that is coming from two aspects. One, the wheat supply of today is totally different from 50 years ago. due to hybridization and so forth to make the plant grow faster. That gluten content has increased by about 50 times. So, and our bodies really aren't designed to adequately digest gluten. And so it ultimately becomes kind of a toxin to the body. The other thing that we have to look at is the widespread use of glyphosate, which is the active ingredient in Roundup. And really that ultimately is a pesticide or antibiotic, right? But it's widely used, to kill off weeds and so forth. But it's also just globally sprayed on, the wheat plants. And as a matter of fact, a whole host of plants, fruits and vegetables, for its various effects at controlling weeds and in the wheat industry as a desiccant to enhance the harvest and make it a much faster process. But that has become quite a problem with the health of our gut microbiome and all of the functions in our body. So, so those are some of the things from the standpoint of how can we communicate to our patients what's a better diet. Obviously, eat as organic as possible. Another aspect is genetically modified foods. So yes, there are some benefits of genetically modified things in our society. However, the genetically modified foods in the soy and grain and so forth milieu have become quite problematic. Corn is at the highest level of genetic modification. So corn and soy being one of the staples in our diet is also causing decimation of our microbiome. So, I say to my patients, definitely have a more organic diet, avoid GMOs, and really pay attention to what you're putting in your mouth. Gluten, for the vast majority of people, is actually a problem, but they just don't know it. So doing testing for gluten sensitivity, I think, is very, very important, especially if someone is suffering from any type of disease syndrome. And doing a gluten test from, say, the big box labs from LabCorp or Quest is generally quite inadequate because it only tests for one type of gliadin. It's called alpha gliadin, but there are many subtypes of gliadin, omega, gamma, et cetera, et cetera, et cetera. So there are labs that can test at a higher accuracy rate to ascertain whether you truly are gluten sensitive or not. But short of that, even without doing testing, again, if someone is suffering from any type of issue, autoimmune or what have you, do a trial of staying away from gluten and dairy for that matter, because kind of same thing for traditional dairy farms. The milk is there's genetic modification in that, and hybridization, hormones, and so forth. And again, from the 50 years ago, it's the casein, which is the protein component of the milk, has also been implicated in causing, autoimmune issues, leaky gut issues, and so forth. So, from a standpoint, again, going back to the patients, eat as organic as possible, stay away from packaged foods. If you cannot pronounce what the ingredients are on the package, it's ideal to kind of stay away from that. And ideally, don't consume packaged foods at all. Eat live foods in their organic form. And that would go a tremendously long way in helping someone's health.
So is it just gluten? And what foods contain gluten? Or is it all grains that with
So,
lectins in it that can open up the gut and cause contents to leak through?
so no, gluten is a protein primarily in wheat, barley, and rye. Now there are, rice has gluten in it, but the gluten that has been found to be the main offender in most instances would be the wheat, barley, and rye families of foods. Now, sometimes one would need to eliminate grains from their diet as well. But everyone is very individualistic where it comes to that. I found that people who have chronic pain may benefit more so from eliminating grains from the diet. Um, Also, lectins, which are found in the skin of like tomatoes and bell peppers, um, those can also be implicated in eliciting an autoimmune response. And really, all of these things, the goal would be, if we're getting back to the root cause of, production of disease in the body, the gut is one of the main arenas for that. So the goal would be obviously eliminating the sources that are causing this, continuous leaky gut. And why that's important is because, so, when we consume foods, our digestive system, should be able to break it down into very, very tiny molecules. But the new problem with the gluten and so forth is a much, more robust molecule and is not adequately broken down. And what it does is it causes irritation of that gut lining and actually promotes, the opening up between the cells. And really in the gut, it's only one cell layer thick. So it's not very robust. So that irritation effect causes the gates to open up between the cells, and these molecules get out in a form that the body should not see. So then the body responds to that as if that gliadin or that gluten molecule from the wheat or the casein or the corn or any other foodstuffs for that matter, even foods that you would think would be healthy, like broccoli or asparagus and so forth. When it's not appropriately broken down, it is causing those cells to separate, and then those molecules get into the body, and the body's immune system basically says, what is this? And it starts attacking it like it's a parasite or a bacteria or a virus. The ultimate problem with that is that due to a process called molecular mimicry, and it's a big word, but it kind of, it sounds like what it is, those molecules from the gluten or dairy or what have you can start looking like your body organs. So the body is doing what it does best. It's trying to protect you, right? So it's making those immunoglobulins and attacking those things because it thinks it's a foreign invader. But then those gluten or dairy molecules can actually start looking like your pancreas. So that could result in now you having an autoimmune form of diabetes, or it can look like your thyroid and it can start attacking that gland. And then you have an autoimmune form of hypothyroidism called Hashimoto's, or it can influence Graves' disease where you're making too much thyroid hormone. It can attack your skin so that now you develop eczema or psoriasis or what have you. It can attack your brain, which can lead to Alzheimer's and Parkinson's and dementia. So that kind of puts it more into focus how critical our gut is and having good gut health and having the absence of leaky gut. Because when you start that cascade, it's very, very difficult to control if you are not very diligent about what you're consuming. And this takes, this can take months or years, to develop into whatever syndrome. But it is one that, because now we have an epidemic of pretty much every disease out there, and it's only getting worse. So it is incumbent upon us all to determine what things are continually causing inflammation in our bodies.
Macular degeneration is a leading cause of vision loss, with 15% of Americans being at risk or already affected. Scientific evidence proves that by using mesozeaxanthin, lutein, and zeaxanthin together replenishes the macular pigment and promotes healthier vision. This formula comes in only one product, MacuHealth.
How does the body determine, or do we know why in some people it attacks the thyroid, and in some people it attacks the brain, and some people our body attacks the skin?
So, I mean, everyone has a weak link though, so it's not totally determined why that occurs, but I would say from a genetic level and an epigenetic level, one can be more predisposed to a certain body organ being attacked than others. And of course, the environmental things that we're exposed to are turning genes on and off that would be implicated in the expression of disease. I also look at doing genetic testing on patients as well. It's not the end-all be-all, and there's still a lot of research to go. Of course, we actually do have whole genome mapping now that is in the $1,000 range, where you can actually map your whole genome and find out all of these different things. But still, with doing things like 23andMe, it yields a lot of information, and of course, there are a ton of companies out there. I tend to use companies that are more physician grade versus 23andMe, but a lot of people know about that. And that gives you a lot of information on what you could be vulnerable to. So it's very, very illustrative of, things like how you react to having inflammation dealing with homocysteine. So if you have what's called the MTHFR variant, and that could predispose you to having high homocysteine levels, and homocysteine is very inflammatory to the body, and that's one of those other root cause things that we need to look at. And that's really only elucidated when, I would say, functional medicine practitioners are doing those types of tests, because unfortunately that's not a typical test that is ordered by a traditional doctor. Things like homocysteine and C-reactive protein, which really give us a good idea of underlying inflammation that is really brewing and causing a multitude of problems.
So if we go back to the scene of the crime, the microbiome, how important is diversity? And what's the ratio of bacterial cells or viral cells to human cells?
Oh, it's a huge disparity, like 20-some million to, our thousands. So, the microbiome is, it is what is deemed the second brain. And because of that, that diverse environment is intimately entwined, again, with our overall health. It is said that we are really more bacteria, viruses, and parasites than we are human. And that has been borne out with the research that has shown that significant disparity in all of our regular cells versus our synergistic compatriots.
And talk about diversity. How do we increase diversity if that's important?
So yes, diversity is extremely important. And also because of, again, kind of scenarios where we're exposed to genetically modified foods and pesticides and so forth, that's killing off a good amount of our good bacteria. So I would, of course, I'm a big proponent of using probiotic strains in patients. Also, eating a variety of fermented foods, also very, very critical in terms of increasing, your microbiome diversity. So, as with, again, kind of depending on what your labs show, and there are numerous tests that one can do, gastrointestinal tests to assess the level of diversity in your microbiome. And of course, most of us have, especially if we are suffering from any disease syndrome, that's really, really high on the list. And most of those individuals have a marked reduction in diversity. So, putting patients on the appropriate probiotics, and by all means, every probiotic out there is not created equal. So using very high grade probiotic supplements that have verifiable strains that are live strains is incredibly important.
What is some of your favorite brands of probiotics?
So I really like the Claire Labs has a multiple strain probiotic that's very good. But I've also really enjoyed using Megaspore, and that's a spore-forming probiotic with the strains of Bacillus subtilis and Bacillus indicus and so forth. And you don't have to have those in the billions of colony-forming units. These are in the several million, but a great amount of research that has shown that helps stimulate the growth of the good bacteria, diversity in our guts. And of course, we also don't want to just utilize probiotics. What we really want to also concentrate on is prebiotics. So obviously the best source of that would be, our prebiotic foods, the resistant starch type foods, the vegetables and so forth, which help us make our own bacteria. And there are also supplements that you can get as prebiotics, psyllium husk and so forth, that will help stimulate the body to have a food source for the existing bacteria there, and will stimulate new populations of good bacteria.
So people with autoimmune disease, you explain beautifully some of the things they could do. Is there any other supplements or any other strategies that people with autoimmune disease should ask their functional medicine doctor about, or they could actually do on their own?
So, well, let me kind of go into one of the really exciting realms. I'm also being trained by Dr. Trimp and Dr. Lewis with the first book, The End of Alzheimer's, and having the elucidation of, Lyme disease or toxoplasmosis or Epstein-Barr virus and so forth, being at the root of disease syndromes, especially neurodegenerative diseases. I'm also trained by Dr. Dale Bredesen, who wrote the second book, and it's titled the same name, The End of Alzheimer's. But it's the functional medicine approach of elucidating root causes, and more focus on Alzheimer's and so forth. But this has implications in pretty much every disease syndrome. And he grouped them into types, so type 1 being inflammatory. So again, kind of going back to some of your basic or expanded biomarker tests, looking at homocysteine and C-reactive protein, which are indicative of significant inflammation and wreaks havoc in the body's system. And there are other, biomarker tests that we can do, but type 1 being inflammatory. So everyone pretty much knows that most of diseases, have an inflammatory component. So if the body is chronically inflamed, that's not a good scenario. His type 1.5 is deemed as called glycotoxic. So that has to do with, you being on the metabolic syndrome diabetic spectrum. So having insulin resistance also is a key component. And of course, we know we have an epidemic of diabetes. And of course, it brings with it its whole host of negative effects on the body. Type 2 is dealing with hormone deficiencies. So if we look at, especially in men and women, we look at testosterone and estradiol, those being low. And, even in young men and women, we are finding that there are low levels of testosterone and estradiol. Again, also due to toxicities and so forth. We also look at low levels of thyroid hormone. So if that is low, that's going to significantly affect cognition. We also, again, look at cortisol levels. So if there's adrenal dysfunction. So those are root causes that we have to ferret out. Type 3, that Dr. Bredesen elucidated, is toxic. And that's becoming a very, very important realm, especially in our younger patients who we actually have 40-year-olds that are developing Alzheimer's. And that is generally found in patients that have heavy metal toxicity, such as high mercury levels. And high mercury levels can come from our food supply, unfortunately, especially from our fish supply, and also from dental amalgams. So if you have silver fillings or gold fillings, a high proportion of that is actually mercury. So again, if you cannot detoxify mercury and other heavy metals like lead very efficiently, it's going to build up in your system and cause problems, brain problems as well as other problems. So those are tests that are very important to set levels and see where a patient is. Type 4 is a decrease in blood flow. And again, that is very, very common. Everyone, of course, knows about cholesterol's role in cardiovascular disease, but ultimately, cholesterol is not truly the enemy. Cholesterol is actually sent there to heal the inflammation, that the destruction of the vessels that the inflammation has caused. And that's truly why cholesterol is found in plaques and so forth. More importantly, is buildup of calcium. So, and now at least traditional doctors are doing more of the heart calcium scores, where it's a CT scanner that tells you the buildup of calcium in the arteries and so forth, and also looking at the carotid arteries, see if there's thickening there. So, of course, having a decrease in blood flow will affect brain issues, but again, whole host of issues. So that's very, very important. So those are things that I assess. And then type 5 is traumatic brain injury. And that doesn't have to come from, just being a football player. All sports, well, the vast majority of the sports do have high incidences. Soccer is actually the highest incidence of having concussions and so forth. And so those are, root causes that we really need to delve into. When I'm looking at a patient, I have a very extensive questionnaire that goes into, exposures, history. It takes about at least 2 hours, to a minimum of 2 hours, depending on the person's, what they're going through, to kind of ferret out what everything, the exposures that the person has come across. One thing that I forgot to mention in the type 3, mold toxicity, very, very high on the ladder. And about 25% of the population actually has a sensitivity to mold, and they don't know it. And of course, the vast majority of us who are in the workforce, uh, a good number of those buildings are actually water damaged, and mold is growing behind those walls. And even in our homes, there's a high degree of mold. And of course, it doesn't affect everyone the same. And the ones who really, seek the functional medicine practitioners, they have very serious symptoms, but it can manifest as anything. So again, from root causes, we have to really dig deeply. And that's really one of the main things that separates traditional doctors from functional medicine doctors. And of course, I've been a traditional doctor when I was doing anesthesia for 16 years, but really started, you know, really becoming intrigued with the deeper dive assessment of patients with pretty much every disease syndrome. And there is something, pretty much every disease has something that you can put your finger on it as this is the cause, or the multiple reasons, exposures and so forth, that is the cause of the expression of this disease. So one really just needs to look more in depth at what a person is consuming, what they've been exposed to, looking at a deeper dive in the labs and so forth, to really ascertain what is causing that expression of the disease.
Why do you think conventional medicine doesn't look for the cause and just kind of treats symptoms?
Well, I think traditional medicine at this point is so medication centric, and it has become actually quite a bit worse over the years from when I was practicing. And traditional doctors really don't have the time to really find out what the root causes are. So because they're pretty much so busy with the new drug of the day or the week or what have you, that the drug reps come in and say, well, doc, all right, this previous medication that you were working with, now we have a replacement for it because it had too many side effects or what have you. So I think they are basically overwhelmed. Most doctors are seeing 30, 40, 50 patients a day and can really only spend about 10 minutes with a patient. And it's impossible to really understand what the root cause is. It's very easy to prescribe a medication in that 10-minute session based on the brief history and then looking at the lab results. But again, that's more just addressing it from a symptomatic approach. And of course, at this point, we have pretty much medication overuse. A number of patients that I deal with are on 5 or 10 or 15 different prescriptions. And of course, each prescription comes with its own host of side effects. And all of these cross-reactivities with these traditional medications is also causing problems. And the vast majority of those medications also cause leaky gut, which further fuels problems in the body. So again, the goal is to find out the things that are fueling the inflammation and so forth, and all of the different things, and start putting a plan together. The unfortunate thing is it takes time. It really does, and that's the biggest hurdle that I come across with our patients, because they want instant gratification. So they like to feel better in a day or two. But when it comes to functional medicine, it's a much slower process. And again, kind of looking at those deeper dive things like heavy metal toxicity and mold toxins and so forth. Those are things that take months, if not years, to successfully lower in the body. And it's mostly years, actually. and especially for patients who are, suffering from significant disease syndromes. So one has to be very, very patient to go through this elimination and detoxification process. So while there are supplements that can help with certain symptoms in a more timely fashion, this is still a supplement. So we're still not addressing the root cause. So the only way to really get the body to heal is addressing this over long term. And really, since we are always exposed to toxins on a daily basis, this is a lifelong thing. So that's one of the more difficult things to get across to patients, because they do want quick results. And sometimes that happens, but more times than not, it doesn't.
It makes me think, what was the incidence of Alzheimer's, cardiovascular disease, macular degeneration back in the late 1800s?
Yes, I'm sure very, very low. Again, when we actually have now Alzheimer's being probably the 4th or 5th leading cause of death. In the UK, as a matter of fact, it's actually the first reason of a cause of death. So we are at epidemic proportions of this. Nursing homes are full to the brim. And the cruel thing about Alzheimer's is it doesn't kill you slowly. You can, linger for 5, 10, 15, 20 years with a very, very low quality of life. And unfortunately, this has, there's so many factors that are associated with it. And there's no slowing down in sight, unfortunately. So traditional medicine really does not have anything to offer. The vast majority of drugs out there that have been developed are designed to decrease amyloid, but now we know that amyloid buildup is not the cause of Alzheimer's. And in fact, amyloid is more likely a protective mechanism to protect it from heavy metals or bacteria or what have you. And it's really preserving as much function as possible. So unfortunately, memory is kind of low on the totem pole in terms of functionality of keeping you alive and so forth. So that's kind of the weak link where it comes to Alzheimer's and your memory. So again, if we can get to patients early and identify the causes of the memory loss, then we can very successfully reverse that whole dynamic. As you're further down the line, benefits can be, definitely enjoyed. However, getting someone totally back who's in a memory care center is quite the challenge. So don't want to give the impression that everyone can be cured of Alzheimer's. However, things can be made better. And again, since we have this huge incidence, and of course, it's not all genetic at all, just based on what I, elucidated earlier, but there is a genetic predisposition. And I would say it's probably a good idea for everyone to get their genetic status, which is called the ApoE genetic variants, to determine if you have that. And even if you have that, it's not a death sentence. So there's no reason to become upset. But now that you are armed with the information, you know that you have to be very diligent about your environment, what you eat, and a whole host of things, and really optimizing, all of the more expanded lab values that a functional medicine doctor can provide for you.
Well, Dr. Carter, we have a lot more to talk about. We will continue the conversation in part 2, and we will make that available to our listeners next week. I look forward to continuing our conversation.
Since I bought Safe For You, my dad makes me clean his boat.
Es natural y es un buen producto.
Every time I go back to school, my mom always makes sure that I have my Safe For You products. I bring extra, and my roommates certainly don't mind.
It's a good thing I had Safe For You to clean up after this little guy.
When my hands get dry, I like to wash them with Safe For You.
And most importantly, the reason why I buy Safe For You is because it's safe for me and you.